Understanding abnormal psychology. What makes behavior abnormal? What exactly is abnormal psychology? The term might sound clinical or even a little unsettling, but in truth, it's one of the most fascinating and human areas of psychology. Abnormal psychology is the study of thoughts, emotions, and behaviors that fall outside what we consider typical, not just in terms of being different, but in how they impact a person's ability to function, feel balanced, or connect with others. In clinical and therapeutic settings, abnormal doesn't mean bad or broken. Rather, it reflects patterns of thinking, feeling, or behaving that cause significant distress, dysfunction, or deviation from what is considered typical within a given culture or context. These patterns often arise from a combination of childhood experiences, epigenetic influences, and past events that have shaped an individual's beliefs, coping mechanisms, and subconscious conditioning. The purpose of studying abnormal psychology is not to label or pathologize individuals, but to understand the underlying causes of their emotional and behavioral struggles, so that we can guide them toward healing, balance, and integration through compassionate, evidence-informed care. This production is part of an educational certification program series offered by Liberated Learning, the Holistic School of Liberated Living. While it was designed for our students, we've made it available to the public so that anyone can benefit from the insights of holistic health and wellness education. To learn more about our holistic health programs, continuing education, and professional development opportunities, or to explore how to become a licensed or board-certified professional, please follow the link provided HolisticSchool.Online. The goal of studying abnormal psychology is not to label people, but to understand why they feel the way they do and how to help them heal. Let's break it down with a few examples. Example 1, anxiety disorders. Imagine a college student named Maya. Every time she's asked to present in class, her heart races, her vision blurs, and her mind goes blank. At first, she thinks it's normal nervousness, but soon she starts skipping classes and avoiding social events altogether. Her anxiety isn't just uncomfortable, it's interfering with her life. From a therapeutic lens, Maya's behavior fits the functional definition of abnormality. Her coping mechanisms, avoidance, withdrawal, are maladaptive. A clinician might use cognitive behavioral therapy, CBT, to help her challenge anxious thoughts, combined with mindfulness or exposure therapy to build confidence. Example 2, depression and emotional dysregulation. Then there's Carlos, a successful executive who suddenly loses interest in everything: work, relationships, even hobbies he once loved. He can't pinpoint a cause, but he feels numb and disconnected. Clinically, Carlos might meet the DSM-5-TR criteria for major depressive disorder, but a holistic therapist would go deeper, exploring not only his neurochemistry, but also his diet, sleep, trauma history, and sense of meaning. Using the biopsychosocial model, the therapist looks at the interplay between biology, neurotransmitter imbalance, psychology, negative self-talk, and social environment, career stress and isolation. Example 3, addiction and coping. Now consider Elena, who began drinking wine to relax after work. Over time, that coping mechanism became a nightly ritual, then a dependency. Her drinking helps her avoid emotional pain from a past relationship, but it's also costing her sleep, health, and connection with loved ones. This is a perfect example of what researchers call experiential avoidance, a concept from behavioral and acceptance-based therapies. Elena isn't just using alcohol, she's using it to escape uncomfortable internal experiences like shame and loneliness. Clinically, this behavior falls under abnormal psychology, but therapeutically, it's seen as a protective, though unhealthy, coping response to adapt to stress versus healthy adaptation. Treatment might involve acceptance and commitment therapy, ACT, or trauma-informed care, helping her face, rather than flee, her emotions. A historical perspective. Centuries ago, people viewed these struggles through vastly different lenses. In the supernatural era, distress was seen as demonic possession or divine punishment. The biological model later reframed it as brain disease or chemical imbalance. The psychological model, introduced by Freud and others, explored unconscious conflicts and early childhood experiences. Today, clinicians integrate all three, understanding that mental health exists on a continuum influenced by genetics, environment, and experience. The holistic viewpoint. From a holistic mental health perspective, abnormal is not a label, but a language of imbalance. Symptoms like depression, anxiety, or addiction are messengers pointing to something deeper: unmet needs, unresolved trauma, or biological dysregulation. Healing happens not just through diagnosis, but through understanding the whole person: body, mind, and spirit. A client with panic attacks might benefit from nutritional therapy to stabilize blood sugar with plant-based protein, breathwork to calm the nervous system, and cognitive therapy to reframe catastrophic thinking. The goal isn't just symptom reduction, it's restoring harmony. Case integration, the biopsychosocial model in action. Let's take a final case. Aiden, a 22-year-old college student, seeks therapy for panic attacks. A clinician using the biopsychosocial model might explore the biological lens, family history of anxiety, high caffeine intake. On a psychological level, perfectionism, fear of failure, self-criticism. In a social perspective, academic pressure, social isolation, and cultural expectations. Treatment integrates all three: biological, psychological, and social, with gradual exposure to therapy, nutritional adjustments, and supportive community engagement. Over time, Aiden learns that his panic isn't a flaw. It's a feedback loop that can be understood, managed, and transformed. Abnormal psychology, then, is not about labeling what's wrong with someone. It's about uncovering what happened to them and how to support their return to balance. It's where science meets empathy, diagnosis meets understanding, and treatment meets transformation. Restoring balance, holistic approaches to abnormal psychology. When we talk about abnormal psychology, it's easy to get lost in diagnostic terms, labels like depression, anxiety, or borderline personality disorder. But at its core, these conditions are not just about what's wrong with the person, they're about what's out of balance. The goal of healing isn't to suppress symptoms, it's to restore equilibrium between mind, body, and spirit. Modern psychology recognizes this truth through a biopsychosocial model, but holistic psychology goes a step further, adding the dimension of energetic and spiritual integration. This approach doesn't reject science, it enhances it, connecting neuroscience, mindfulness, nutrition, and somatic therapy to promote full-spectrum healing. Psychotherapy, rewriting the narrative. At the foundation of any therapeutic process is psychotherapy, a safe, structured space where clients explore their inner worlds, challenge distorted beliefs, and reframe their experiences. For instance, someone with post-traumatic stress may be caught in a loop of intrusive memories and hypervigilance. A skilled holistic therapist might blend cognitive behavioral therapy, CBT, to address negative thought patterns, eye movement desensitization and reprocessing, EMDR, to process trauma, and somatic awareness techniques to calm the nervous system. Here, the focus is not just on symptom management, but on understanding the root imprint, the emotional or physiological memory stored in the body. By processing that energy, true integration begins. Cognitive behavioral therapy, CBT, changing thought to change biology. CBT remains one of the most evidence-based tools in mental health, yet from a holistic view, it's also deeply energetic. When a person shifts their thinking, they literally alter their brain's neural pathways, a process known as neuroplasticity. Take Maya, the student with severe social anxiety. Through CBT, she learns to challenge her automatic thoughts. I'll embarrass myself, they'll all judge me, and replace them with balanced, compassionate statements. For example, CBT counter thoughts. Even if I make a mistake, that doesn't define my worth or ability. Everyone makes mistakes. There is nothing wrong with being human. Most people are focused on themselves, not judging me. I've handled uncomfortable situations before. I can do it again. Feeling nervous doesn't mean I'll embarrass myself, it just means I care. Compassion-focused, holistic reframes. It's okay to be human. Everyone feels vulnerable sometimes. My value isn't determined by other people's opinions. What matters most is showing up as my authentic self, not being perfect. This is an opportunity for growth, not a test of my worth. Genetic recoding, subconscious healing perspective. This fear comes from old conditioning. I'm safe now, and I choose confidence. I release inherited beliefs of not being good enough and replace them with self-trust. CBT doesn't just teach new thoughts, it teaches the brain safety. Pairing these counterstatements and reframe thoughts with mindfulness meditation, breath work, and nutritional support, such as stabilizing blood sugar with healthy protein levels and balancing B vitamins, reduces physiological anxiety and creates new patterns of calm. Holistic interventions, healing the whole system. Holistic mental health integrates therapies that honor the entire human system. It recognizes that mental distress often has physical, energetic, and environmental roots. Some of the most effective integrative tools include nutritional therapy, supporting neurotransmitter production with omega-3s, magnesium, amino acids, and balanced meals for mood regulation. Somatic and breathwork techniques, releasing stored trauma through body-based practices that downregulate the stress response. Energy psychology, methods like emotional freedom techniques, EFT, or theta healing, help dissolve energetic imprints that keep people stuck in emotional pain. Mindfulness and meditation, training the mind to observe rather than identify with thoughts, reducing rumination and anxiety. Movement therapies, yoga, tai chi, and dance therapy integrate body and mind, increasing endorphins and improving emotional regulation. Nature and light exposure, grounding in natural light, fresh air, and rhythm helps synchronize the circadian system and elevate mood. Each modality contributes to restoring coherence across the nervous system, brain, and biofield, creating an inner environment conducive to resilience. Integrating traditional and holistic approaches. Holistic psychology doesn't replace clinical treatment, it complements it. A person with major depressive disorder, for example, may benefit from psychotherapy and natural supplementation, such as adaptogenic herbs or flower remedies to stabilize mood. But recovery deepens when they also engage in nutritional counseling, trauma-informed yoga, and creative expression like journaling, dance, or art therapy. The integration of science and spirituality, cognition and compassion, and treatment and transformation offers what traditional models often miss: connection to meaning. Clients begin to see their symptoms not as flaws, but as feedback, signals guiding them back to alignment. Case study, a holistic healing journey. Consider Aiden, the 22-year-old experiencing panic attacks. Biological, his caffeine intake and poor sleep increased physiological arousal, spiking cortisol levels, and depleting adrenaline reserves. Psychological, his perfectionism fueled catastrophic thinking. Social, he felt isolated in a high-pressure environment. Treatment included CBT for reframing fears, progressive exposure therapy to reduce avoidance, breathwork and meditation for regulation, and adaptogenic herbs like ashwagandha, licorice root, and holy basil to balance his nervous system. Over time, Aiden's panic transformed into awareness. He learned his body wasn't attacking him. It was asking for change. Epigenetic healing and genetic recoding. At Liberated Living, we take this one step further with genetic recoding, a process that identifies and reprograms inherited emotional and epigenetic patterns. Many abnormal behaviors are adaptive responses to generational trauma, stored not only in the psyche, but in cellular memory. Through guided subconscious work, visualization, and cognitive restructuring, clients can turn off maladaptive gene expressions and turn on resilience-based pathways. When we change how we think and feel, we change how our biology behaves. The goal, from disorder to integration. The purpose of abnormal psychology, from a holistic standpoint, isn't to pathologize. It's to understand and integrate. Every symptom is a story, every behavior a communication from the body-mind system. Healing happens when that message is heard, processed, and transformed. True therapy is not about fixing what's broken, it's about remembering what's whole. This has been Holistic Approaches to Abnormal Psychology, part of the Liberated Learning Certification Series, brought to you by Holistic School.Online, where science meets soul in education and healing becomes transformation. Explore accredited programs in holistic psychology, naturopathic medicine, and integrative mental health, and learn to guide others toward balance, resilience, and freedom. Discover the Panacea Self-Healing System and Cognitive Restructuring Workbook to overcome trauma with holistic healing tools to use personally or for your clients. When we meet struggle with compassion, curiosity, and acceptance, we step beyond the limits of diagnosis and into the true work of healing. Each program includes professional online training, an internationally accredited diploma, a comprehensive therapy workbook, and a turnkey business model designed for immediate practice success. Our flexible learning pathways empower practitioners to launch fulfilling careers while working remotely from anywhere in the world. Begin your transformation today and receive a free ebook on recoding subconscious beliefs at liberatedliving.com. Explore 25 plus holistic programs. liberatedliving.com programs. Apply as a holistic professional. liberatedliving.com application for professionals. Save more. Take 25% off when you subscribe or become a VIP member and enjoy 50% off exclusive rates with an annual $75 membership. Join at liberatedliving.com loyalty. Visit Holistic School.Online to begin your journey today.